If you're a dentist who's always been puzzled why some people use a cart-based operatory, then this video is for you. Hi, I'm Dr. Siju Jacob. I've been in private practice in Bangalore and Dubai for the past 25 years. I've been using a surgical microscope in my private practice for more than 20 years, and I've also been teaching dentists how to use a surgical microscope in everyday clinical practice for more than a decade. In this video, I'm going to take you through 5 main advantages of switching over to a cart-based operatory compared to a traditional arm-based operatory. Most dentists are used to an arm-based operatory. Why? Because an arm-based operatory is something that virtually every dentist sees from the time they are in dental school. And because it's something that they are used to from the time they've been in dental school, they continue that habit even when they are in private practice. So when someone shows them a cart-based operatory, they are very reluctant to change. But just because something is very traditional doesn't mean it's the best option. We are going to cover the 5 main advantages of switching to a cart-based operatory, and by the end of this video, you too will know why more and more dental clinics are making the switch from a traditional arm-based operatory to a cart-based operatory. The first advantage is that the cart helps make your clinic appear more streamlined and more spacious. The nature of the cart is such that it helps you organize everything in one place rather than being scattered all over. All the handpieces are arranged neatly in one place, and because the cart is independent of the chair, you can move it into place without coming across the patient. With a traditional arm-based setup, when you move the arm across the patient, tubes like these tend to have a tendency to fall on the patient sometimes. But the worst thing is the patient tends to feel boxed in because the arm comes right across them and they sort of feel trapped. This can increase anxiety levels. So this is sometimes overlooked. It might seem like a small thing, but it's something that does make a lot of difference, especially if the patient is someone who is very anxious. So the cart-based operatory, because it's separate and independent, you have the flexibility to move it in whichever direction you want, and the patient never feels boxed in or claustrophobic. You are kind of giving the patient a message, hey, if you want to run off, I've left everything open for you. You can just jump off your chair and run off. With the cart-based operatory, this part is always left open. So the patient can psychologically feel that they're not boxed in. The chair arm is not like that. The minute you bring in a chair arm right across the patient, they kind of feel trapped. So this is sometimes an overlooked factor. Second is the ergonomics. Because of the fact that the cart is independent of the chair arm, you have the flexibility to move the cart according to whichever position you want to, depending on the procedure that you are working on. A chair arm based operatory is not like that. It is attached to the chair, so there are certain limitations as to how much you can move it and in what direction you can turn it. It is largely dependent on the position of the patient and the chair. A cart is not like that. You have the flexibility to move it position-wise, you have the flexibility to rotate it in whichever angle you want. You can even increase the height of the cart by adding in extra cushioning or increasing the size of the wheels. So you have all kind of options depending on what your requirements are. And we also cover how to work ergonomically in our online course, and in some of the videos that I've posted on this channel as well. I've emphasized the need for an operator to always be in class 1, 2 or 3 motions while performing everyday clinical dentistry. With the cart, it's much more easier to always remain in class 3 motions and then reach out for instruments, because if you aren't able to do that, you can always reposition the cart and make it in a favorable position in such a way that if at all you need to reach out for any instrument, you can easily do that in class 3 motions. With a chair arm, it's not like that. Because there's a distance and some limitation as to how much you can rotate, you will always have the tendency to be more in class 4 or class 5 motions when working with the dental chair arm. So that is another big advantage when we talk about cart-based operatories versus a chair arm-based operatories. The other thing, if you notice in a cart, is all these instruments that I need can be put in one place. With a chair-based operatory or an arm-based operatory, there are certain limitations as to what all you can incorporate in the dental chair arm. With cart-based operatories, especially if you're working with a company that specializes in carts, like the one which I'm using right now, you can inform the company specifically what all components you want to be be installed in the cart while ordering your cart. For example, you can put things like an intraoral camera, you can add a physio dispenser, you can add whatever tools you want, and they can be incorporated in the cart. So it's a huge advantage because it helps you customize the cart according to your individual need. So that's the second major advantage of using a dental cart. It helps you become more organized and more ergonomic while performing everyday clinical dentistry. The third advantage is seamless documentation. When we perform everyday clinical dentistry, we need some sort of a system to store our radiographs, our clinical pictures, whether they're taken through the surgical microscope or an intraoral camera. And you need a device which can put all these things in one place so that the documentation process becomes a little more seamless. With traditional arm-based operatories, what happens is it's not that flexible. So you have a system where your radiographs are in one place, your sensor is in another place, and then if you are taking macro or microscopic pictures, then those pictures are in some other place, and it becomes a bit of a problem to document and have some sort of a protocol. With a cart, it's really easy. Carts are such that you can incorporate a CPU inside the cart. Okay, so you have a computer inside, and that computer has a provision to attach whatever monitor you want. The size of the monitor can be altered according to your preference, and then you can connect microscope cameras into the computer. You can have an intraoral camera attached to the cart. That too can go into the CPU and then be visible here. So the whole process is very seamless. You can take a radiograph, you can take a clinical picture, and all that get documented into one monitor, which you can easily review at the end of your procedure. So it becomes much more seamless and organized compared to a traditional arm-based operatory. So this is the third big advantage of using a cart-based operatory over a chair arm-based operatory. The fourth advantage of a cart-based operatory is that it enhances patient communication. In a chair arm-based operatory, whatever documentation you have and whatever communication you have to make with a patient, the monitor that you are using to communicate or show images or radiographs to the patient is usually far away and is limited. You can't change positions. Now with a cart-based operatory, the monitor that you have can be changed. You can move it from place to place. You can alter the direction, and if you have a chair where you can rotate the chair as well, you have this flexibility where you can position yourself between the monitor and the patient and sort of have a three-way communication. And we do this all the time. We take photographs, we take radiographs, and at the end of the procedure, we open these multiple windows. If you have a large enough monitor, then you can open up all these windows and then discuss each aspect. For example, if you're showing clinical pictures, you have the freedom to just maximize that window and then show the patient those clinical pictures which you just took in your operatory while doing an examination or a procedure. And then if you want to switch over from that to, let's say, radiographs, then you can just open that window over here, because everything goes into one unit rather than spread all over the place. So you can do that, and you can do all this while maintaining eye communication with the patient. So the communication is much more personalized and much more customized based on the individual patient compared to an arm-based setup. So huge advantage, because the very fact of patients appreciating what you've done. You might be an amazing dentist doing amazing work, but if you can't show that in a seamless manner to the patient, then you are losing out some of those benefits, because you can't make the patient aware of the excellent work that you are doing in everyday clinical practice. So this is a major advantage in a cart-based operatory. The fifth major advantage of switching to a cart-based operatory is the ability to differentiate your clinic in a very crowded market. If you visit 10 clinics in a row, all 10 of them will look almost exactly the same. Almost all of them will have an arm-based operatory. The minute you switch to a cart-based operatory, it immediately differentiates your clinic. It stands out. A patient walks into a cart-based operatory, they immediately feel that this clinic is different from the majority of clinic out there. That again should be a huge motivator for someone to switch from an arm-based operatory to a cart-based operatory. These days, in a very, very competitive market, dentists are running out of ideas to differentiate themselves with the vast majority of the competition that's out there. Cart-based operatories gives you that advantage of differentiating yourself. You are going down a path which the majority, that's the 99% out there, aren't following. So it gives your clinic that opportunity to differentiate itself from the rest of the competition. So for me, this is a major advantage. So I hope that what we talked just now sort of convinced you, at least to some extent, to explore the possibility of converting your arm-based clinical operatory into a cart-based one. Before we wrap up, this is a question I get all the time. Where can I get these carts? Well, there aren't many companies out there in the world that specialize in dental carts. There are very few of them, and to me, my choice is pretty clear. I would go for a company called ASI. I've been using their carts for the past 15 years, and they're super professional. You have a very responsive team who can customize your cart. When you buy a cart, you can kind of speak to them, tell them what all you want in your cart, and they help you design the cart the way you want to put all the gadgets that you need in one place. They give you that flexibility, and once they are in your practice and installed, these are proper workhorses, so nothing much really goes wrong with them. But in the rare even that something does go wrong, they are super helpful, super responsive, fantastic support team. So it kind of ticks all the boxes. So for me, ASI Dental is the go-to place if you need help in designing your clinic and converting it into a cart-based operatory. I put a link in the description below. Just click on that. It should take you directly to ASI's dedicated concierge, cart concierge. They will help you customize your cart, and I hope it will sort of help you take that next step into converting your clinic into a cart-based operatory. If you found content like this useful, then don't forget to click on that subscribe button so that you get notified when I upload a new video, and don't forget to share it with your friends who you think might find it helpful, and I'll see you next week with another video.